Okay, this is the next episode of All Apologies, Guilt, and Blame. It's the third book in my series, Life Beyond Silence. My first book was titled Not a Victim, a Survivor, Life Beyond Domestic Violence and Rape. My second one was titled Losing Touch with Reality. This is also my third podcast. I did podcasts on the other two books as well. So please go back and take time to listen in order of Not a Victim first, then Losing Touch with Reality, and then All Apologies, if you will. That way you get the full story of my life, my mistakes, my regrets, and why I've named this book All Apologies. I guess in this episode, I kind of wanted to take time to go over my heart attack that I had. Mainly it's kind of like a health kind of a what am I looking for? Kind of like I'm trying to give people advice, I guess. I mean, I've been in healthcare for 45 years. I've worked as a nurse in every facet, including cardiac. I've worked in cardiac, ER, general surgery, pediatrics, just every facet, OB. But what happened to me was, as I previously told you, they knew I had a blockage. My blood pressure was out of control. I have diabetes. I was having arrhythmias, chest pain, everything for years. And they did find a blockage. But when they did the heart cath, they decided not to do anything about it because it was under 70%. Now, my first thought, of course, was, what? That's kind of your discretion. Don't tell me it's not. I've worked in healthcare. Why in the world would you not do a stent on me? Come to find out, and I'm not sure that they saw that I had a second blockage, but come to find out, it was unreliable to do a stent or stents in my heart because of the positioning of the blockages. Now, if they had just told me that when they did the heart cath, that would have helped me greatly with the fact that, let's wait, let's observe them, let's go over having an open heart surgery, let's go over having bypass surgery. I would have, and it's not that we didn't go over it prior to the heart cath. We did, but them just telling me the blockage was not up to 70% was in no way good enough. And I was obsessed with the fact that they hadn't done anything for me. I was aggravated. I was depressed. I was having anxiety because I know what can happen if you have a massive coronary. You can just drop dead. And I'm sorry if there's any background noise, but I'm actually sitting on the back porch. But anyway, the point is, one day, you'll be able to figure out when that was, but I don't want to give too many details on a podcast. But one day I was at home, and my daughter's dad was actually in, which is my ex-husband Kyle, but he was actually in seeing her at her home. And I was actually at mine with my little dog, minding my own business, and I started having pain in both of my arms. Now, mind you, it did cross my mind that it could be a heart attack, but that's the only pain I was having. And it was just aggravating pain. It wasn't like so bad I couldn't stand it. As a matter of fact, I did dishes, I did laundry, I think I even vacuumed the floors. It was just aggravating pain, and I was waiting to see another sign that it was a real heart attack. And then I was gonna go to the ER, drive myself, because I definitely didn't want to call an ambulance. But I was having this aggravating pain, and if I crossed my arms and kind of held one arm with one hand and one arm with the other hand, it was okay, and I kept thinking, I don't have any nitroglycerin. My nitroglycerin has been out for a few months, and I was just thinking I need more nitroglycerin, and then maybe I could try that to see if it did go away, and if it went away, then it probably was a heart attack. And I don't know what I was thinking, honestly. Here I am in healthcare all my life. The signs you look for are intense chest pain, feeling like somebody's standing on your chest, not being able to catch your breath, sick at your stomach, back pain, pain in your left arm, jaw pain. There's lots of ways that a heart attack can feel, or symptoms, I guess you would call them. But I just didn't think this was it. I just thought it's pain in both of my arms, and that's it. And I'm still managing to do what I need to do around the house. And I don't want to bother her. I think it was a Sunday, so I definitely didn't want to bother her on a Sunday with her dad here. And I knew my daughter would be aggravated. My kids all love me. I do believe that, but they treat me like I'm just getting old and have aches and pains. And when the doctor didn't do anything for my blockage and told me just wait for your heart attack, I guess they didn't take that as it was imminent, or that it was going to happen at any given time. So they didn't have the anxiousness that I did. They didn't have the worried constantly that it could be a big one happen, and then I wouldn't even have time to get to the hospital. And so I think when I would have called, if I had called, she would have been put out that she was being bothered, and that this was her last day before going back to work on a Sunday, and she has kids, and her dad was leaving, and why in the world would I want to go sit at the emergency room just to have them send me back home? And I was also feeling like that. I was like, why do I want to go sit at the emergency room So they just send me back home. And so basically hold on just a second. Sorry about that. I was checking on my grandson. So basically I just sit there, and I think I even eventually laid down and took a nap because I had taken my blood pressure medicines and my insulin, and I took, ibuprofen, things like that. So I think I even laid down to try to get it to relax and go away. But it didn't. And when I woke up, it was still there. It wasn't worse. It was just still there. And so on Monday morning, I had called to see if I could get some nitroglycerin called in for me. And they did. They called it in for me from my cardiologist's office. And I had an upcoming appointment on Wednesday, and I had tried to get in a little sooner, but they made me wait. And when I went in on Wednesday, she took which she was the nurse practitioner, not the actual doctor, or not my actual cardiologist, let me put it that way. And she did an EKG, and it showed I'd had an MI, which is a myocardial infarction, which is basically a heart attack. That's the more scientific term, medical term for it, is a myocardial infarction. But yeah, it was a heart attack. So she said, let's just do blood work to make sure, and you go home, and if your levels come back and show that you've had a heart attack, I'll call you, and you need to go to the emergency room immediately. I was like, yeah, I know that. So I went home. I already knew what the EKG showed. I already knew it was a heart attack. And I went home and, oh, by the way, when I got my nitroglycerin, my pain in my arms went away immediately. I popped 2 nitroglycerin in my mouth, and they virtually helped tremendously, and the pain went away. And by the time I went in Wednesday to see the doctor, I wasn't in any pain. So she called me at home, and she said, yeah, your levels are high. You definitely had a heart attack. I want you to go to the emergency room and tell them, you've had a heart attack. And I was like, okay, is that all you want me to say? Now, mind you, I came from, rural Kentucky and a more smaller hospital. So the way we did it at our hospital is, in that case, something like that had happened, you could walk in and you could give the doctor's name and say, I just had a heart attack, and they would immediately sign you in, process your paperwork, and get you to a room and get you on meds, and eventually take you down for the heart cath and put a stent in. It would have been super easy. You just would have actually gone through the ER instead of the front door, but you wouldn't have been sitting in the ER. Now, I realize this is a metropolis city. This is Nashville area. There's two major hospitals here, St. Thomas and Vanderbilt. And I realize Vanderbilt is very busy. But it is ridiculous for somebody to go through the ER, sit down with all the sick patients, be taken back, be given an EKG, be telling them that they just came from the doctor's office and they've had a heart attack. And then they go, well, okay, just go out and have a seat and we'll get to you shortly. And you're like, what? Go back out there with all the sick people? Like, you want me to go back out there and sit down? Now, mind you, this is still COVID time. Even to this day, there are people that have COVID. But at the time, it was pretty prevalent. And you don't know if people have COVID. You don't know if they have the flu. You don't know what they have. And there's a lot of coughing, a lot of people that look really sick. But I'm like, okay. So I go back out there. My kids, two of my kids are with me. And we're just sitting there. We're just sitting there and sitting there and sitting there. And by the time this one ER doc gets to me, he's like, well, I don't know if you had what you think you had. And I said, well, I do. You know, and mind you, I tell up front anybody that I have been a nurse for years. And I know what they're talking about. Well, I just looked at him and said, what? He goes, I just don't know if you had what you think you had. And I said, okay, whatever. And so he ordered me on heparin, which normally would be probably the normal thing to do. But mind you, I didn't even have a room at that time. And they had even talked to me about being in the hallway on a gurney. And I was like, no, that's not going to work. I'm not doing that. And so hours passed. They ended up keeping me in the ER, I think a total of 17 hours maybe, before they actually moved me to a real room. And then once I got in the real room, they said they were going to move me again. Okay. And I had sent my kids home because they needed some rest, and nobody was doing shit for me except running heparin. And my one daughter that hadn't come as of yet was like, what are they doing? And I was like, I don't know. I mean, I've never seen anything like this in my entire life. You would think I would go to a heart cath area section and I would have a heart cath and they would put a stent. I get it that they're running heparin. Do they not have any cardiologists that work at this hospital? I know they do, because I've been to this hospital and had a lot of conversations with cardiologists and surgeons. And you can read all this and hear all this in some of my other entries in the podcast. And you can also see information even on YouTube about my heart attack. And what was done and what was not done. Anyway, I was fit to be tied because it was the next morning, and I had told them I have been here well over 24 hours. And if somebody doesn't take me down to have a heart cath, I'm leaving. You understand? Like, I just flat out told him that. And basically right at, I don't know, give or take, it was before noon, but it was late morning, I guess you would say. They took me down, and my one daughter made it in time. And I said, this is ridiculous. Like, ridiculous. And they got me ready. They took me to the heart cath room. You're always in twilight. And there I was in twilight. And I was watching the screen, and I heard the surgeon that was doing it say, okay, well, no. And I heard him say that it was going to be much more than one stent, and that he thought it would be better to have a bypass, and I was going to need a cardio-thoracic surgeon. And I knew what that meant. Nope, not getting a stent, not getting 2 stents. I'm going to have to be seen by a whole flock of surgeons, and they're going to have to set up open heart. So, now mind you, I still wasn't having any pain. Plus, I'd been on heparin forever. But they put me back in the room to explain, which they didn't need to because I'd already heard them. But they did. They explained the situation. They'd have to get a whole team together. I was going to have open heart, bypass surgery, everything. And I was like, no, I'm not. And they're like, what? And even the nurse said, what? And I was like, no. I've been a nurse a long time. It was ridiculous what was done to me. And I said, I'm not taking it out on you guys because you're not the ones that did it to me. But literally, I went through the ER last night. It was crazy. Like, I barely got to a room, and then here I am, and what you're saying is I need open heart. I am not having one single more thing done at Vanderbilt. I am leaving. And they're like, what? And one person, smart aleckly, they had to say something smart. So they're like, so you're signing yourself out? And I was like, yeah, if I have to. I'm signing myself out. And I'm leaving. I'm not staying here. And the doctor kind of, I think, understood. I think the people in the heart cath lab understood that they weren't to blame and that I had been done wrong by the ER and by the doctors that had seen me, or the doctor that had seen me, and that I had been put off and was fed up and was tired. And yeah, this involved getting a whole team together, and they didn't see that that could even happen until Friday. And on this day that I'm talking about, it was like, Monday. And on this day I'm talking about, it was like Friday. So maybe Thursday even. Probably Thursday, I guess. But I said, no, I'm leaving. I'm not staying here. No, not after what's been done to me. And I guess they thought, okay, well, we've got to get a whole team together. She's upset. Let's just let her leave. So they told me I wouldn't have to sign myself out. I could leave. And so they checked me out, and I left. And I told my kids, I said, I'll find my own cardiac thoracic surgeon and I will go to St. Thomas. And yeah, I was upset. I was fit to be tied. And there I had been on heparin for, I don't know, a good 26, 28 hours maybe. And there I was. You know, it was by then probably Friday afternoon. I had a lot to think about. And I honestly told my kids, I don't want to have open heart surgery. You know, I've never had anything happen to me. I've never been a patient. And here I am. This is my first real patient situation. And the thought of stopping my heart for ECMO, which is where they stop your heart so they can work on it, was scaring me to death. And the thought of recovery, if there was a recovery, was also scaring me to death. And I mean, I guess that's what I basically want to tell you, is that it's a scary situation when you go through what I did and then you're faced with open heart surgery. And I get, especially now, I get every patient's fear. I get it totally. When I was working in CCU, I used to think, you know, these people have heart conditions. They're needing open heart surgery for bypass surgery. It's scary, but they have to do it. And I didn't really get it, but now I do. I get it. It's very ominous to have that hanging over you. And a lot of people that actually end up having open heart surgery and bypass surgery, I won't say all of them, but a lot of people, they just had a heart attack and there's no choice in the matter. With me, by then, I'd had my heart attack a week prior. And I was feeling fine. Not invincible, but fine. And I did. I honestly thought, nope, this isn't what I want. I'll get in the car and drive down to Mexico and sit on a beach somewhere and wait until it happens again, and I won't live through it. Because usually if you have a large heart attack, if you go to have another large heart attack, you're dead. Or even a small heart attack. A second heart attack, especially if you've not had any intervention, usually kills you. Hold on a second. Okay, I'm back. I was just checking on him. Anyway, yeah. So, it just so happens somebody I know knows somebody, and I get the name of a St. Thomas thoracic surgeon who was extraordinary. I talked to his nurse on that Monday after the weekend, and she's like, well, we got to get you in. And she set me up an appointment as first available appointment. And, she worked me in. And I went and saw him, and he ordered my test and my pre-op. And then I went back for that. And then my actual surgery was like another week later. So all in all, it was about 2 weeks after my heart attack and I was going in for surgery at St. Thomas. And those people were so nice to me. And that doctor was amazing. I probably will put his name in the description below this podcast, just because I think it was kind of like God's will that hold on a second. Just because he was amazing, and I highly recommend him if you're needing open heart surgery and are able to go to Nashville, or are in the Nashville area. I was in dire straits, and I told him what had happened, and he not only did everything to take the time to go over everything with me, but also my children, and it was just amazing. And after I got out of surgery, no, it's not a walk in the park. It's very, very hard. Recovery was painful. I would say the most pain happened in the time that I was, let's say, the first week of recovery was the majority of the issues and pain. But I did excellent. I pushed myself to do excellent because I wanted to go home. And I was only in there probably from the time of surgery for 3 days. And then he let me go home. And it took me like maybe 2 weeks to really kind of come back to the way that I normally felt. There was still some issues, and they do try to tell you what you can and cannot do, and what's the best thing, the best way to get back on your feet. And I will say I am not the best patient, but I would say probably within a month, I was doing literally everything I had done before, and I was progressing good. There's a lot of more little details I won't bore you with, but that's kind of where I want to end this episode. I just wanted to tell you that when in doubt, if there's even a small chance that the pain you're feeling or the discomfort you're feeling, whether it's in both arms, one arm, nausea, back pain, jaw pain, chest pain, anything, go to the hospital. Don't do like me, who thinks they evidently know it all, considering I've worked in healthcare for as long as I do. Don't do like me. Just go. I just was really lucky. That's the main thing. I was really, really lucky. Okay, so I'm going to end this episode right now. Please keep listening. If you have any comments or questions, just ask. I'll do my best to answer them. And I'll see you next time. Thank you.